This is a bit of a follow-up video and also a reversed scar evolution video. The scar you're looking at right now is from a aortic arch and root replacement done in 2017. It's now almost 5 years to the date, and this is what the scar looks like. Not everybody's scar looks like this, but this is just particularly how this one appears. You can see the scar actually starts up here, and there's an area of decreased pigmentation, and the scar is actually flat and soft, and this is likely due to an underlying collagen vascular issue that's still being worked out genetically. You can see the mid portion of the scar is a little bit more hyperpigmented and raised, or almost keloid-like, which is a particular type of scar that can form depending on genetic predisposition and some other factors. Flattens out here in the middle, and then again down here much more of a raised scar. None of this is painful. None of this has really had excessive sunlight exposure, and it's fully mature, being 5 years out. There's really not a whole lot that will be anticipated to change with the scar, other than maybe some further flattening and hopefully some decreased pigmentation in these two parts here. So a little bit odd that light, dark, light, and dark. This scar was actually part of an experimental procedure. This wound was healed using what's called a wound vac. And so post-operatively, a large sponge was placed over this entire area with a occlusive plastic type dressing, and then in the center part of it was a small vacuum tube that was connected to a vacuum pump, which was maintained to suction other than when I was out of bed walking around for the better part of 5 days. Post-op day 5, they took that off and just left it open to air to heal on its own. And so this is what it appears like. The subsequent pictures that you're going to see after this are the healing phase played backwards and reverse. You can see the full initial video here on YouTube as well, but I just wanted to share this as a follow-up. I have numerous other scars in my body, some surgical and some otherwise, and this one is probably the most unique. The other surgical scars that I have are completely flat. They are almost undetectable. This one just happened to occur at the age of 45, where the other ones occurred primarily at the age of college. So there's a variety of factors that go along with scar healing and wound healing. The age of the patient, underlying genetic predispositions, the type of wound, how it was caused, whether there's any infection present, nutritional state of the person, chronic diseases, lack of hydration, poor circulation, swelling, trauma. Some people have a predilection to scratch or pick at scars. That also affects healing. And then after the scar itself is healed in the initial phase, sunlight can play a bit of a role as well. Scars that are exposed prematurely to excessive sunlight can become a little bit dyspigmented compared to the surrounding tissue. So generally, rule of thumb is to protect the scar with sunblock. Obviously, this is not medical advice, but obviously the risk of melanoma and other types of skin cancer are accelerated by excessive sun exposure. So that wraps up this part of it, and then let's just play the rest of the scar evolution backwards. Let me know what you think. Take care.